Hi, I'm Diana Aquino. It's the number of 145371233. I'm here today to do the neurologic and musculoskeletal assessment. Now do the 360 video. Do hand hygiene, check room for any contact precaution, provide privacy for the patient. Hi, I'm Diana. I'm your nurse today. I'm going to do the neurologic and musculoskeletal assessment for you. Will that be fine?
Yes.
So confirm your name and your birthday, please.
Lisa Uy, March 1, 2000.
Okay, so have you experienced any headache or any pain, back pain, joint pain?
No.
Have you had your recent injury or fall?
No.
Any problem with difficulty of speaking, swallowing?
No.
Any problem with movement?
No.
Okay, so upon inspection and observation, client is appropriate with appropriate mood and well groomed, and she has a good hygiene. Patient is fluent with her speech and clear, so she is alert and oriented. Please walk over here and back. Now check for the spine. Bend. Okay, thank you. So, patient gait is balanced and movement is coordinated, spine is intact and no deformities noted. So for the cranial nerves 3, 4, and 6, which are oculomotor, trochlear nerve, and abducens, please follow my finger without moving your head. So for the pupillar checkup. So cranial nerve 3, 4, and 6 are intact. So for cranial 5 is a trigeminal nerve. So please close your eyes and tell me, where do I touch your face?
Forehead, left cheek, right cheek, chin.
So trigeminal nerve is intact. And can you also do the clench of your jaw? So cranial nerve 5 is intact. So for cranial 7, which is facial nerve, can you smile for me? Show your teeth. Raise eyebrows. So cranial 7 is intact. For cranial 8, vestibulocochlear nerve, can you cover your left ear and repeat after me? Bubble tea.
Bubble tea.
And right ear?
I'm pretty.
So cranial nerve 8 is intact. So for cranial nerve 9, 10, and 12, the glossopharyngeal, the vagus and hypoglossal nerves, can you say ah?
Ah.
And move your tongue up and down, side to side. And so cranial nerve 9, 10, and 12 are intact. So cranial 11, which is accessory muscle, can you move your head left to right, up and down, and your shoulders up and down. So cranial nerve 11 is intact. So for the range of motion, we're gonna do the neck. So please move your, for the flexion and extension, move your head up and down. And for the lateral flexion, can you move your head, your ears towards your both shoulders? And do the, for rotation, face to the left and right. And for the head, shoulders and elbows, can you do the flexion and extension? Move arms forward and back. And for the abduction and adduction, and move your and back to the other side and back. And for the circumduction, move circular motion. So for the internal and external rotation of the shoulder, move your shoulder inward and backward. So for the pronation, so do like this That's the pronation, and move your arms upward for the supination. For the wrist, do the flexion and extension. Move your wrist down and back. And for the ulnar and radial deviation, do your wrist towards your thumb side and your wrist towards your pinky side. So for the hips and knees, so please raise your right leg and your left leg and do the extension and flexion and the abduction and adduction. And for the hip rotation, move outward and inward, and do it for the other side. And for the ankle, can you do the dorsiflexion and the plantar flexion? So for the range of motion, the movement is 5/5 and bilaterally equal movement. So I'm gonna do the assessment for the upper and lower extremities. Her skin is warm to touch. The color is appropriate with the ethnicity. There are no bruises, and there are no lesions and edema. So I'm gonna check the capillary refill. So capillary refill is less than 3 seconds. And that's all. Thank you, and do the 360-degree video. Yeah.